Welcome everyone to our first energy seminar series of fall 2020. And I think people will still keep trickling into the virtual room just as they do the real room when we get to do this in person. But in the meantime, I'd like to get us started close to on time. And I'm going to start by introducing our first speaker of the year, Professor Pozzo. She's the Boeing Roundhill Professor of Chemical Engineering at the University of Washington, where she's been since 2007. Her research includes expanding the uses of nanotechnology in clean energy and healthcare applications. She also leads the entrepreneurship education program within chemical engineering, and with her students has founded numerous technology ventures. She also leads the Puerto Rico Health and Energy Emergency Response Field Study Project, which engages students and faculty participants from a number of disciplines. She grew up in San Juan, Puerto Rico, and obtained a BS in chemical engineering from the University of Puerto Rico at Mayagüez, and a PhD in chemical engineering from Carnegie Mellon. She has also worked at the NIST Center for Neutron Research as a postdoctoral fellow. And her talk today, which is entitled Meeting Our Global Obligations, Hurricane Maria Energy and Health Project, will focus on some of the work she's done in Puerto Rico. And so with that, it's my sincere pleasure to hand the virtual microphone to our first speaker for the Fall 2020 Energy Seminar Series.
Well, thank you very much, everyone, for the invitation. I feel honored to be your first speaker, and also for the invitation. I wish I could be there in person to greet you all and to get to know you better, but hopefully that'll happen sometime in the future at some point. So the organizers asked me to speak a little bit about me. As you know, I grew up in Puerto Rico. I actually was born in Argentina, so I have a very interesting childhood in the sense that I've moved all across North and South America. Never moved much in terms of East-West. I've always stayed in the Americas. But yeah, when I was a kid, my parents moved us to Puerto Rico, and I grew up in Puerto Rico, then went back to Argentina, and eventually actually even moved all the way up to Canada, where I finished my high school, and then decided to go back to Puerto Rico for college. So as you see, like I had a little bit of a mixed childhood that really opened my eyes to how common things are across different cultures, right from Latin American to Caribbean cultures all the way to North American cultures, but at the same time, how similar we are in the things we're passionate about. So yeah, I feel like I am a little bit of a citizen of the world, and for me, it's interesting now to be a U.S. national, where because I have these perspectives that come from all different places. I went to graduate school then at Carnegie Mellon. And my research really focuses on materials. And so this is a really different talk than I'm used to giving, because it is a project that really came out of passion because of it's related to the place I grew up in. But it really took me outside of my comfort zone in terms of expertise. And as you're gonna see, it really forced me to, or essentially, yeah, forced me to create connections with experts that came from very different angles from what I'm used to seeing when I'm actually in my circle of research. So this is something that I totally encourage you guys to also do, and hopefully you'll like the talk. So let me just actually get started with that. So like I said, I'm going to first start with a little bit of what my research is, so you can understand how different that project that I'm going to focus on today is from my research. And I hope that you guys can take this as a little bit of inspiration, mostly because I feel like we grow so much when we really stretch ourselves outside of our comfort zone. So my research really is in soft materials, and really is focused on materials. I wouldn't even categorize my group as being an energy group. We have projects that are related to energy. So for example, We do a lot of work with conductive polymers or conjugated polymers, and these are materials that are used in advanced solar cell applications. But we're really interested in learning their properties and how they relate to their function. We also have projects where we essentially are just interested in understanding self-assembly and other materials behaviors from a very fundamental point of view, so that there might not necessarily be any real application related to them. It is just to understand the fundamentals of it. But similarly, we also have projects that are involved in healthcare. So we also are interested in medical imaging applications using these soft materials. And more recently, we've been doing a lot of work with trying to accelerate the development of materials using high throughput experimentation. And I could totally give you another seminar that just highlights any of these particular areas. But today I'm going to focus on a very, I mean, it was a very rewarding experience for me, but at the same time, very orthogonal to what I usually am used to working on. So we are still motivated in my group by many modern day challenges. So we are in fact in an engineering department and an engineering group. So we do touch on materials that definitely have relationships to clean energy. Like I mentioned, solar cells, but right now my students are also working on materials to improve energy storage. And as you're gonna see, these are technologies that are critical, right? Not only in our transition to a more sustainable world, but also in areas related to energy justice and energy access. And that's what's going to be a lot of what I'm going to talk to you about today. But we're also trying to solve problems that are related to clean water access, disease management. Like I mentioned, we have some healthcare related projects, and then sustainability of both access to food, polymers, and infrastructure. So always thinking about the future and how will the world actually look like for our kids. So like I said, I grew up in Puerto Rico. For those that may not know, I mean, it's this island in the Caribbean. It's essentially associated to the United States as essentially as a territory of the United States. But so the Puerto Ricans are citizens, but they don't get to vote in elections, in presidential elections, which is something that is very unfortunate. But I had a really great life growing up in Puerto Rico. I feel like I've been actually very, very fortunate. So this is a picture of my family as we grew up in San Juan, as was mentioned in my introduction. I actually married a Puerto Rican. So my wife, Marvi, is actually from the center of the island. So this is a town called Jayuya, which is very different from where I grew up. It's actually very much rural and isolated. It actually, from Ponce to Jayuya, it would take you almost an hour to get there because of the winding roads. It will take you the same time to get from San Juan to Ponce, which is a much longer distance. And then I went to the University of Puerto Rico in Mayagüez, which is essentially the primary engineering campus of the University of Puerto Rico. So if you grow up in Puerto Rico, you're used to hurricanes. This is a common place. You must have experienced at least one or more likely many more than one during your lifetime. In my case, I happened to experience at least two major hurricanes. The first one was Hurricane Hugo, which essentially happened when I was in essentially elementary school. So Hugo barely crossed the northern part of the island, so it really did go through San Juan, so we did experience it. There were around like 12 fatalities because it fortunately didn't actually go through the center of the island. So what happens when you experience a hurricane in Puerto Rico? So typically you'd first essentially start undergoing preparation. So fortunately, we can realize, right, because of weather stations and satellites when a hurricane is about to hit. So you usually have time to prepare. And this allows you to essentially stock up on foods that are gonna last you if in the event that there is a power outage. So a lot of canned foods and water, because water may also run out. You would secure the outside of your business or your home. So you would probably add tormenteras, which are essentially boards that go on the windows to prevent glasses from shattering. During the hurricane, then you would experience most likely a very scary night, but you would do this with friends and family, so you would feel a little bit of comfort in that everybody would be with you. Electricity will undoubtedly go out. Like it doesn't take much to actually lose power in Puerto Rico. The electrical grid is not extremely robust, so you'd anticipate that the electricity would just run out. And then afterwards, then you would assess the damage, and a lot of work is involved, cleaning debris. There's a lot of trees and natural plants and essentially around your houses in Puerto Rico. And so they undoubtedly get damaged, and you'd have to work physically to clear this out. You typically have a massive cookout because your refrigerator will lose power. So a lot of that food needs to be used up before it spoils. And you also learn to live with minimal water. So I have a picture of the toilet because you can imagine what that actually entails when you're living with minimal water. So, but I have to acknowledge that my experience of hurricanes, right? And I experienced two hurricanes. One was Hugo and the other one was Georges while I was in Puerto Rico. It was very different than that experience of other Puerto Ricans. So for example, when Georges hit the island, I was actually in college in Mayagüez, and my experience was very similar to my experience in Hugo, just some cleaning up and some bothersome because I didn't have water or power for a few weeks. But many people actually had their lives completely upended by Georges. So you can see the damage because of flooding and complete destruction of some of these households. So I realized I grew up in a very privileged situation. My household would be something like this house, which is typical of San Juan households and many other middle class concrete houses. So they're built like a bunker, and they're built this way because we expect that we're going to have hurricanes. This is very different from the household that many other Puerto Ricans actually live in, that might be built out of wood, that might not survive hurricanes, or that might be built in flood-prone areas like this one here. Moreover, I lived in San Juan, right, which is the capital, where you have clear access to hospitals. Food and water and emergency services are the fastest to be essentially come back because people try to service large populations much faster than small rural towns. So we recovered pretty fast. We would have typically maybe a week or a couple of weeks at most. Importantly, for the topic of what I'm going to talk to you today, no one in my household was seriously ill. So everybody was healthy. That meant that we could actually, I mean, for us living without water and living without electricity for a few weeks was really just a little bit bothersome, but not really something that we feared for our lives. So something going back to 3 years ago, something that people might forget is that before Maria, which is the topic of this talk, there was also Hurricane Irma. And Hurricane Irma was a monster. Arguably, was actually even larger than Maria. And it essentially decimated a lot of the islands in the Caribbean. But fortunately for the Puerto Ricans, it actually missed the majority of the island. But still actually eliminated power for many of Puerto Ricans that lived in more rural locations. But the damage wasn't anywhere near to what happened in many of the Virgin Islands. So here's a picture of, for example, St. Martin, which was decimated by Hurricane Irma. So essentially, right after the hurricane passed, Hurricane Irma, Puerto Ricans actually, who are very generous people, started coordinating a response to actually help out essentially their neighbors in the Virgin Islands. So this is a picture of donations being packed onto just civilian ships to be shipped to neighboring Virgin Islands. What people didn't know was that brewing right after Hurricane Irma was this other monster of a storm that was Hurricane Maria. And Hurricane Maria would unfortunately not miss the island. In fact, it actually went right through it. So here's a picture of the three hurricanes that I mentioned so far, right? Hugo barely crossed over the northern part of the island. Georges passed fairly close to where I was living in Mayagüez, but Maria came as a Category 5 hurricane and it crossed right through the center of the island. So it decimated the power grid in Puerto Rico. A lot of households lost their roofs. They were completely destroyed and completely uninhabitable. And this happened nearly in every municipality in Puerto Rico. So here's a picture from the Washington Post. So this a camera for looking at satellite pictures, looking at light intensities. So this is Caguas, which is a suburb of San Juan. So it's not that far from San Juan. And this is before Maria, 8 days later, 13 days later. And most of these lighting that you see reinstated is not because of the power grid coming back up, but merely because people were able to get generators and start to get some power locally in their own houses. So how did we experience Maria living here in Seattle? I mean, I remind you, my wife is Puerto Rican, so she also grew up in, all of her life in Puerto Rico. So we were desperate because we couldn't actually get any communication in or out of the island. And all of the news that we were hearing were essentially from social media. We didn't know about our family members for nearly a week. And we didn't know how they were doing, if they had actually survived the storm well enough. There was clearly from social media scarcity of supplies. People were rationing fuel. So even if you had a generator, you weren't necessarily able to actually power it because you weren't necessarily having access to fuel. We saw pictures like this one where it says actually, help, we need water and food. So people were going hungry. And we had no idea about how our families were doing. And this was not just for us, right? Like every other Puerto Rican living in the US had this same experience. So a lot of people coordinated, and I'm familiar with the coordination in Seattle because that's where I live. So other Puerto Ricans that live here, they all band together and they essentially tried to coordinate shipments. A lot of donations started to flood into the islands, many of them organized by, for example, restaurants. Like we have this restaurant that created a foundation to move materials. But I mean, moving water and food from Seattle all the way to Puerto Rico seemed like a little bit like counterproductive. Like, is that really what we can do, right, to help the most from a distance? So being at the university, I wanted to do more, and I wanted to figure out like how can we actually help. And it became clear during this communication in social media that the suffering that people were experiencing was also not equal, especially people that had medical conditions were really fearing for their life. So I'll translate this particular post in Facebook. It says, my grandma has only 2 hours left of oxygen. She lives in the town of Moca and we need help, please. We can pay for it. We just need to know where to get it. We need to transport her to a hospital, which would be an option, but we have no ambulance and she is actually bedridden. So you see posts like this and you realize that there are some people really fearing for their lives and their loved ones. So we decided to then actually look into this particular problem and try to understand how is suffering actually distributed, right? Like who is suffering most and how do people that depend on electricity for their home healthcare actually are experiencing these hurricanes. So I would separate this into 2 categories. One is severe dependence on electricity. So these are people that need electricity or they will die. And these are examples of, for example, if you have renal failure and you're on dialysis, you need to essentially have dialysis on a regular basis every week, or else your kidneys will stop functioning and you'll die very quickly. There are people on respirators. So these are essentially artificial breathing apparatus. they need to be transported. They depend on electricity. And there's a lot of people also, like the tweet that or the Facebook post that I posted, that depend on oxygen. And oxygen became also a very scarce resource. Then there's people that are seriously, that have serious dependence on electricity, but they will see their healthcare deteriorate slowly without access to power. So a lot of asthmatic patients receive their asthma medicine using nebulizers that require electricity. There are sleeping disorders like apnea, where you need also a positive pressure machine or a CPAP machine. There are mobility issues, right? If you have essentially an electrical wheelchair, or if you're bedridden, those are also requirements of electricity. Lots of people with diabetes and special diets that were being affected because they couldn't refrigerate their medicines or their foods. And then there were also feeding apparatus, right? A peg feeding is when you have a tube that goes directly into your stomach to help you with feeding. So the first thing that we realized we needed to do was to understand what we don't know. So this is something, an exercise that we don't always do, but we should. And some of the things that we don't know are how many people are dependent on electricity? What % of the population is this? How many of these can actually evacuate? Who are they, and where do they evacuate to? Or even where they are located to. How much electricity is required by individuals with specific conditions? So I showed you several examples in the previous slide. It turns out that all of those electrical devices for healthcare actually use very different amounts of electricity, and they have very different technical needs. Then what are the long-term health effects of power outages, right, on these communities? How do people adapt during these emergencies? So people are very creative, and they will, I mean, when they're faced with adversity like this, they will try to find solutions. So what are they doing in order to actually get their needs met? Now, more in technical aspects, how do alternatives to receiving grid energy, right, which is out during an emergency like this, how do these actually perform? So it's very common in Puerto Rico, if you're in a middle class or upper class family, to have a gas or a diesel generator. You can buy these at Home Depot and other places, and they can power some basic essential things like your refrigerator or maybe a fan and things like this. But then how are they performing in the case of emergencies for healthcare? How are solar systems actually working? So a lot of people in Puerto Rico are starting to get solar power installed into their houses. But then are they actually benefiting from these solar systems during an emergency if the grid actually comes down? And then the question we also had was, could microgrids increase resilience, community resilience for this in these situations? Lastly, what are technological, educational, and social and economic barriers to implementing emergency power? So we realized that there is essentially a function, right? If you wanted to define how vulnerable is a community, this is a function of how diseases actually are represented in these communities. What is the architecture of the grid? So how likely is it that they're going to lose power for a significant amount of time? And then what is the risk that they're going to experience a disaster? So with this, we recruited several students and scholars from across the university. I'll point out that these students came from all over the university. They weren't my research group students necessarily. And the aim was to essentially provide a service and educational opportunities to these students while also helping to address some of these questions. So this is a education, service, and research mixed project where everybody is getting something out of it. The students are getting hands-on education, real-world education, crash course, if I want to say, whereas we're also providing services to communities and at the same time learning about these important questions. We decided to focus on Jayuya because that's the hometown of my wife, and we had a lot of contacts with the people there that we could actually help us coordinate this project from all the way back in Seattle. And the background of the people were from electrical, chemical, aerospace, civil, material science, industrial engineering, and even health services. None of us had actually hands-on experiences working in these type of situations, so we were all forced to learn. We also recruited experts. So Charbel is actually part of our population health department, and he helped us to coordinate the IRB approvals and how to run a human research study where we wanted to learn about how people were experiencing these disasters. And George Rowe is an expert in this type of microgrid systems that also helped us to coordinate the project. So we coordinated 3 different trips. One was a scoping trip that essentially took place in November. Remember, Maria hit Puerto Rico just about a couple of months earlier, just almost exactly 2 months earlier. And by this time, the majority of the town was, of the island was still without power. Then we had another trip, a follow-up trip in March, and another follow-up in July of 2018. And this is a plot essentially of how many customers actually had power in the island of Puerto Rico during this timeline of these trips. I'll point out, however, that Caguas, right, which is more mountainous, had a lot less power reinstated than San Juan, which is the capital. So during the scoping trip, we focused on running a lot of interviews. So the students actually prepared questionnaires, and we interviewed both essentially citizens in the town of Jayuya, but we also interviewed healthcare practitioners. So there's a small clinic in Jayuya that we were able to interview. There were community organizers that were coordinating, helping their residents. So for example, we were able to install small refrigerators to store insulin in one of these community places where people were already distributing other resources like diapers and food and so on. But that trip really focused on learning the scope of the problems that people were facing. So what did we actually learn? We learned that very sick patients, like dialysis patients, were evacuated very quickly, which is great. Still, many of them didn't make it because there was no guarantee that whatever they were going to be evacuated to had access to power. There were energy insecurity that was essentially interfere with regular healthcare. So for example, vaccinations were completely halted. So if you had children that actually needed vaccinations, they couldn't get them during that time. Pharmacies closed because they had no way of actually selling, or like cash was not easily available. Electronic records were also impossible to access. So people were relying on whatever they had actually in printed records. People with respiratory conditions were seriously affected too. So oxygen therapy patients were experiencing significant interruptions. Many of these depended on oxygen concentrators, and they were no longer able to access regular oxygen tanks, which had to actually be shipped from other bigger cities around the island. And sleep apnea patients also could not sleep for weeks because of their apnea machines, their CPAP machines essentially not working. So we realized also that there needed to be more information and more education that was essentially administered during this type of natural disaster. So for example, insulin users would stop their treatment because of fear of degradation of their insulin, even though it's actually well known that insulin can actually still remain fairly active even when stored at room temperature. The lives of most people was upended. So even if you had fortunate to have a generator, you still needed to travel, more than 30 minutes to get either fuel for the generator, or if you didn't have a generator, to actually access electricity. So a lot of people were traveling these distances to get their asthma therapy, for example, at a place where there might be electricity available. There's also an economic impact. So many of the families had their expenses increased significantly. So even if you had a generator, you were typically spending more than $10 a day on just the fuel for to run that generator, which was only giving you very limited electricity anyways. So that's around like $300 a month. And just for comparison, my electrical bill is around like $50 a month. And it gives me much more service than a generator would for some of these families. There's not only the problem of the economic problem of the generator, but also the fumes and the noise. So this created a lot of conflicts between neighbors. People couldn't run them overnight. So even if you had a generator, you couldn't run these overnight when you're trying to sleep if you had sleep apnea. And then the diets were adversely affected because of the lack of refrigeration. So a lot of people were eating really, really bad quality food, very high sodium content because of the fact that they were eating most everything that was canned. So the solutions to many of these problems you could imagine are in the development of microgrids. So if we didn't rely on a centralized grid, then we would have high resiliency. So a microgrid is a small network of electricity users that essentially contains the users, but also the supply of electricity and the storage of electricity. And most of people that think about microgrids are imagining these several houses and perhaps even businesses that are connected together producing and storing electricity. But there's a thing also called a nanogrid. And a nanogrid is even smaller than a microgrid, as you can imagine. But it still has all of the integrated production, storage, and use. So it is still acting like a grid. So a single home that has a home-based solar plus storage system is actually a nanogrid if it's isolated and not sharing it with other homes. What we were doing, we were giving these nanogrids, right, even tinier than a single home. We figured that these emergency systems that contain a small amount of storage, a small amount of generation using solar systems could potentially provide a solution for emergency power during these situations. So what we decided was to actually specifically evaluate how do these nanogrids, very, very small grids that are supposed to provide just emergency access for healthcare purposes, how would they compare to a generator or even not having access at all? So we decided to essentially, and procured funding enough to actually install these 20, I think it's around 21 or so small scale solar powered systems that had a battery, a charge controller, and a solar power array. They varied in terms of their photovoltaic array size and also in the batteries. We decided to investigate how these users actually benefited from these solar power systems. So we installed this throughout the different trips across Jayuya. So these are pictures of the students doing these installations. We essentially went across all different kinds of patients, across all kinds of different places in Jayuya. The installations were done by the students themselves, so they had to learn, I mean, hands-on, essentially how to design and properly size these devices, how to put them together, how to train somebody on proper use and management. So what are our field observations? Well, from interviews, right, that we performed before and after giving these systems to the local communities, we realized that there were some significant misconceptions on the cost of solar energy. So people felt that they were completely outside of their reach, that they would never be able to essentially have access to these types of systems, when in reality, they weren't much more expensive than the diesel generators that they would actually typically buy. So we also realized that there was some important needs for educating users on how to properly maintain and use these systems, since they weren't very familiar with them. So for example, a lead acid battery requires a lot more management than a lithium ion battery. A lithium ion battery, you can completely discharge and do this multiple times and you won't kill the battery. Whereas if you do the same with a lead acid battery, you can kill the battery very, very quickly. We also had to educate people on what can and cannot be connected into these systems, since they obviously were completely much smaller than what a generator could actually produce. but they had additional benefits that could actually be provided in the specific area of healthcare. We also need to understand better what is a critical load during an emergency. And this is something that we did not realize well in advance. So for example, a lot of users really ended up wanting to connect radios or TVs, right? Which we had understood that they were for entertainment purposes, but in reality, it's part of mental health, right? Like if you're isolated in a rural town in Jayuya, or actually very far from the town itself, having access to communication and knowing what is happening in the outside world is an essential need. And then we needed to know also how frequently people use and what are they using, what are the power loads for these devices, these medical devices. So small scale systems that we installed typically would only power one medical device and maybe a little bit of lighting. But this was enough to actually run a CPAP machine that would serve somebody for their apnea, or they could actually serve an asthma patient that needed regular but short-lived medication that was administered through a nebulizer. So these are very, very low consumption devices, electrically actuated beds. So this is something that we learned, is that bedridden patients are frequently in these beds that actually need to prop them up and down whenever they are getting fed or whenever they are getting changed. And when power goes off, these motors stop working and there's no way of moving these beds manually anymore. So even a small amount of power can actually be a major impact in somebody's life because you can help them get the treatment that they actually need. And then feeding pumps also are very low power devices that actually, these are low energy and intermittent uses. The medium systems and the large systems instead, they were sufficiently large to run a refrigerator, so they could actually supply food if you're on a special diet or help you store your insulin. And then many people also would like to, like I mentioned, use their TVs after 16 months without power. It's an essential need. The lithium-ion batteries, we also learned had actually a significant advantage in emergency situations because of the low weight. So transporting them and transporting more of these materials, even for us, was much easier. And for the users, they could move them from room to room. And many of the users that we supplied these systems to were elderly people that had actually significant trouble moving the lead acid batteries. It's also much easier to manage them. You can extract all the energy, and then when you don't have any more power, then the user knows that they need to actually charge it again. Whereas with the lead acid battery, they had to monitor and make sure that they didn't discharge it more than 50%, or else they would actually kill these batteries. However, lithium-ion batteries cannot fly. So if you're trying to provide emergency service in an island, this is a significant hurdle. And we benefited from the fact that there were some distributors in the island that had access to them. They're also much more expensive. So that also is a significant barrier. So again, we did do some power audits on some of these devices that people were connecting, and this is the diversity of devices that we found. And you can compare, for example, the consumption of a CPAP machine or a sleep apnea machine is only 34 watts, but it needs to run 9 hours during the night. So it has a significant advantage for in terms of compared to the use of a generator. But if you're trying to run an oxygen concentrator, then you need a significantly large solar system to actually be able to provide this amount of energy. So oxygen concentrators were not something that we could power with the devices that we had because they were too weak in terms of the amount of solar energy that was being provided. Nebulizers and all the other ones were totally fine, and there were small amounts of power, but that can really change somebody's lives. We were also able to add some data logging features into the devices that we supplied. So that allowed us to actually understand how users were using these devices. And we could compare, for example, the photovoltaic input, which is essentially charging the batteries, and compare that to the loads that the users were actually extracting, or the electricity that the users were extracting. And you can see that they mirror itself fairly well. Some households actually use the systems a lot. Other ones use them much more intermittently. They would use it, stop, use it, stop. And some of them got electricity back, unfortunately, didn't have to use it again. And this analysis that I'm going to show you in the next few slides was actually published recently, so you can actually read a lot more about this in an IEEE magazine. We could also learn about the specifics of how much peak power and how long were the users using the electricity for different devices that they would connect. So for example, in this particular household, you can see the refrigerator being used. You can see when the entertainment system and how much consumption that actually utilized, but then compared to a nebulizer, which is extremely inexpensive in terms of electricity use. And a PEG patient, right, had a very small solar power system, and they used it intermittently only when the patient was actually being fed by a tube. So we learned a lot about how people were using these devices, and this became really interesting because it's right at the boundary between technical and social aspects of how power affects people during these situations. We also could monitor the system management. So fortunately, most of the systems that we installed were functional. We had one that was actually problematic from the beginning. And even the students were able to do a lot of troubleshooting remotely. So they were able to train the users and help them maintain their systems by essentially just continuing communication even when we were here in Seattle. What we did realize was that there was actually a almost binary distribution between people that had good management. So they essentially followed the instructions that were given to them of effectively keeping the batteries below 50% discharge. And some users actually couldn't do that. They actually needed to use more power. So presumably these batteries were managed a little bit more poorly, and you would see them degrade faster than anticipated. We needed essentially to have these energy loads in order to optimize the system sizes. So a lot of the, I mean, we had unfortunately, due to timing, had to purchase all of the components before traveling to the island and knowing what the needs were going to be for individual users. So we had to actually kind of like find the best match, but it was clear that some systems were actually undersized and they needed additional solar panels to be able to charge, fully charge their batteries during the use. So we ran also some surveys to understand how do they actually compare their experiences using generators versus these emergency solar power systems after about 1 to 3 months of use, and this vary depending on when the users actually recovered electricity. And overall, everybody preferred these solar systems, primarily because of the convenience. They didn't have to actually go seek fuel, right, for the generators, which was a scarce commodity during an emergency. There was no cost, right, also for them. It was essentially free. So even if they could find fuel, they would still have to buy it if they had a generator. And there was no maintenance, so no change of oil, no noise, and no fumes. So this was very, very important if you were, for example, getting your treatment overnight, like in the case of the CPAP machines. There were concerns, particularly related to the limited capacity. So like I mentioned, these solar systems, many of them were undersized, and they couldn't actually compete with the amount of electricity that a generator could actually provide. We did do also some analysis trying to understand the economics of what would make sense, right, for a user to decide to buy a small scale generator versus one of these emergency systems like the ones that we installed. And it turns out that obviously the solar system is more expensive initially, but it has zero or very small essentially replacement cost because there's no fuel or oil to change. Whereas the generator has a much smaller capital cost, but then it has a significant recurring cost due to the fuel and maintenance. So it turns out that if you're expecting that on average you would, on the lifetime of your system, right, which might be 10 years or so, you might experience more than 65 days without power. Then it's much better to actually invest in a solar system in terms of the economics. So how can we move forward? Well, we can anticipate that power outages will continue to happen. And we need to improve our understanding of how energy and health are essentially connected to each other. Again, this is not my area of expertise. I am kind of like, I pursued this because of the need and because of the fact that it was related to my community. But this is something that I hope other scholars actually will continue to investigate. There is some information out there in journals, including this example from Hurricane Sandy that evaluated who is showing up at emergency rooms when there is an extended power outage. And this is actually from New York, right? So essentially the Northeast of the US during a very short power outage compared to what happened in Puerto Rico. And it turns out that the patients that they were seeing were exactly the same patients that we were also seeing in Puerto Rico as more critically affected. People that depended on oxygen or had respiratory conditions like ventilators and so on. So these people are essentially an important community to actually investigate further. We also need to facilitate more agile and responsive research after these kinds of disasters, not just specifically to energy and healthcare, but just in general, right? When there's an earthquake. We have a hurricane right now approaching the Gulf Coast, right? And the question is, how can we respond and learn about the situations that are facing these communities? And this is really challenging the way we do research, because I mean, there just aren't enough scholars, I think, that are actually looking at these important problems. Even though there are definitely people that are working on this, I think that we need more. We need to engage more students in real-world service, education, and research. This is one of the most rewarding projects I've ever worked on, even though it's outside of my my field of training. And we need also funding agencies to support this type of research. And lastly, we need to acknowledge that we don't have all the answers, and we need to learn a lot more about these types of problems. So looking forward, I think that actually there are a lot of opportunities, particularly with the advent of big data. And we now have a lot of information that is publicly available in, for example, flood maps, even the connection of the electrical grid. So this information is becoming more and more available to researchers. And we also have disease prevalence maps, right? Where like in my home institution, the Institute of Health Metrics and Evaluations is mapping essentially the prevalence of disease across the world. So what if we could actually take all this information together and cross-correlate it to have a much better risk assessment for communities? This would help them prepare, anticipate these disasters, and also help emergency respondents to prepare a more savvy and educated response to these communities. What I can tell you for sure is that history will repeat itself. There will be more hurricanes. Hopefully it won't be as catastrophic as what happened in Maria, where more than 4,000 people perished. But we know that they're gonna continue to come, and it's up to us how we are actually gonna be preparing. So there are lessons also to the West Coast of the US, and I included California, Oregon, and Washington here. We don't get hurricanes, but we do get earthquakes and fires. And we've seen a lot of issues with electrical power outages that are related to those. Our electrical grids are also vulnerable, and we need to acknowledge that, and we need to prepare for that. We also have populations that are dependent on electricity. So it's not just in Puerto Rico that people are dependent on oxygen, and that we have asthma and apnea and all these respiratory diseases and mobility issues. We have to know where our populations that are dependent on electricity are located and what their needs are. There's also an important message here in terms of how government policies affects community resilience. So for example, where I live in Washington, there are few or no incentives for home battery installations, even though we know that like if I have my household and it has a solar system and I have a battery, I could become an oasis for power, right? In the case of an emergency for my neighbors. this can be incentivized, more installations of batteries, if we had, for example, time of use electric billing that allows you to actually recover economically the cost of installing a battery system. Yeah, this is an important thing for policymakers to consider in terms of increasing community resilience. So we always evaluate the clean energy in terms of its economic potential, but we rarely quantify what it does for other unmeasurable aspects like, or harder to measure aspects like community resilience. And then microgrids obviously are much more reliable than having a centralized grid that could be affected by an emergency like what we saw in Puerto Rico. For all of you, I would encourage you to know your loads, your critical loads, and this is important, especially if you have a loved one or maybe yourself that depends on electricity. It's very important that you know how much your critical devices actually consume, so you can have a plan for emergency power. And like I showed you in the previous slides, this fluctuates quite a bit depending on what your needs are. This is one of the last slides. I just want to mention that even though the project in Puerto Rico ended as the emergency ended, the students really felt energized about this, and they actually started a student organization called GRID. So I'm the faculty advisor, and it stands for Global Renewable Infrastructure Development. So now, instead of actually focusing on just emergency power, they're actually also building these nanogrids and delivering them to communities where they don't have access to electricity right now. So they've had several trips to Guatemala and other places in Latin America, and actually planning for some projects also in Africa now, where they've developed very similar scale systems, and they've deployed them in the field. And again, this is a service, education, and research project, because they're learning about how these communities are using these systems and how much the devices that they want to connect use electricity. How does a small amount of electricity impact somebody's lives? So if you want to learn more about this, if you want to learn about the situation that affected Hurricane Maria, there's this website outlining individuals' experiences after the hurricane. So it's a very powerful read. If you're interested more about this specific project, there's this paper that came out in the IEEE Power and Energy magazine, and I encourage you to read that. And if you're just interested in general about how we can enhance the resilience of our nation's electricity grid, there's this really nice, essentially, report from the National Academies that I can encourage you to go through. And with that, I'll stop and be happy to answer any questions. Finally, I want to acknowledge the Clean Energy Institute, who provided travel support, and Clean Energy Group actually provided a lot of the support for the devices that we purchased, and many, many, many individual donations that also helped us to secure the funding that we needed for this particular project. Thank you.
Thanks. I guess on an online seminar we can't clap like we usually would, but let me just say thank you for that wonderful presentation. I already see some hands raised. Maybe we can do questions like that, and I'll sort of MC them. So I see Greg Miller's hand is up if you want to unmute yourself.
Thanks, and thank you for the presentation. Very amazing work that you did, and to just hear about all of these issues is something that I hadn't really thought a lot about before. You mentioned that your primary expertise is not in energy systems, and yet you had this connection to the community, and you worked with this multidisciplinary team to go and do all of this amazing work. I'd be curious to hear, throughout this project, what was the role that, some of those team members that maybe had more expertise in the energy systems were able to play? And for us as energy researchers primarily here, what is the type of role that we can play to continue this type of work, or answer critical questions that were maybe unanswered?
Yeah, that's a great question. So, like I said, I'm a materials researcher, right? So I mean, even though we work on energy materials, we're far removed from, the type of expertise that is necessary for a project like this. So we fortunately had several members of the group that did have expertise related to that. So for example, here, Chanaka and Mareldi are both electrical engineers, and they helped us actually with proper sizing of the devices. And they're also, actually, their PhD research is on microgrids. Now, they're much larger systems, but they're looking at things like how proper management of energy systems actually works. So they did all of the analysis, the numerical analysis that actually got published in that paper that I highlighted here. So it was really more of like, I feel like I was just more like a matchmaker and catalyzer, like getting people motivated and maybe coordinating with my contacts in Puerto Rico, right? And also through my wife. But we knew what we didn't know in terms of needing expertise, and that was what motivated us to contact people from essentially global health to help us with the questionnaires. I had never put a request for IRB research before, so that was completely new to me. And like securing funding for this type of work, even taking students to a potential situation that, I mean, it could be challenging, right? Like that was new to me too. I've never flown with students to an island just after a hurricane to run a project like this. So there was a lot of learning, and all I can encourage you is to think about a lot of opportunities lie when you stretch out of your focus, and I think that the students from Grid are a great example of that. These are also coming from all different research areas. Many of them are working on polymer solar cells or materials that are really far removed from what they're doing here. But this makes them more motivated to actually work further on their PhDs, because they're realizing that what they're working on actually has future potential in helping people, real people.
Great. I'm going to keep emceeing here. What I'm going to do, I'm going to ask Tabaya to ask his question, and then we'll hop to some of the questions that showed up in the chat. So Tabaya, do you want to unmute yourself?
Yeah. All right. Thank you. That was a really great talk. I appreciate all the work you've done. I guess my question, to keep it short, is I was kind of wondering if, for like a larger undertaking, if do you think this could be, the kind of work you guys did could be replicated on a larger scale? You know, this more like long-term resiliency from like a FEMA type organization. And I guess the second question with that would be, what would have to happen? Do we need more research efforts to make that happen?
Yeah, that's a really great question. I think my feeling is yes. I think actually not only FEMA, right, should think about these type of responses, right? Like, I mean, FEMA obviously coordinates the supply of emergency supplies, like generators, and this happened in the island. There were nearly no solar systems, right, being distributed. So even if you get a generator and you're suffering from sleep apnea, it really didn't help you very much because you couldn't run it overnight. So really understanding how do the needs of a community relate to the response that best benefits them, that's super important research. And I mean, there's so much more that needs to be done than what we actually could do in this particular project. So that's one thing. The other question that came out was what is the role of like essentially health insurers, right? Like, should a health insurer actually pay for some of these systems, right? Or some of the emergency support in terms of like so the initial answer is no. Like right now, they don't actually pay for this. But is it economically smart, right, for them not to invest in these type of systems when these emergencies can lead to the deterioration of the health of the patients that they're insuring, and therefore a larger cost essentially downstream, right? Like they would actually need more and more treatment later on as if their situation actually becomes worse. So health insurers should also consider the role of emergency power. I think that there's a role also for individuals. They especially, I mean, if you have one of these situations, then you need to also learn about how to properly prepare yourself. So yeah, there's definitely a role for all of these different players to actually take a look at this type of problem and how to service it. The situation in Puerto Rico was particularly aggravated also because of the fact that it's an island. So you couldn't really leave, right? Like everybody was affected at the same time, and that made it much more challenging. I think that in the U.S., evacuation is a little bit facilitated, right? Even though we have experiences that are still pretty bad in terms of like Katrina, for example. So yeah, it's a complex problem, but definitely there needs to be more investment in this interface between the needs of patients and what are the best services that can be provided.
Thanks. So I think that Tobias' question actually prompted a response for, that kind of answers Claire's question on the chat, which is but this is specific to the student group, is the grid team thinking about installing nano-grids in the US? It seems it could be useful to do similar, basically replicate what was done in Puerto Rico in areas, for example, that are subject to public safety power shutoffs, which of course affects much of California.
Yeah. I think I didn't answer part of the previous question also related to that. So grid. So this is interesting. You gotta realize also what is the role of a university in this particular problem versus an NGO or an organization that really their role is to secure funding and to essentially provide long-term services. So I've been trying to help Grid really come up with their identity, right? And I think that they've actually arrived at this kind of like aim where they realize that they can best contribute by researching these projects. They are not going to compete with an NGO in the sense that the NGOs have many more resources that they can actually respond much faster. Students have additional responsibilities and so on, but they have also the preparation, the technical preparation to help them analyze, right, how these complex data sets can be actually interpreted together to understand how a problem like this actually has multiple different angles, right, that are essentially, that need to be analyzed together. So they're really focusing their efforts in trying to understand the research aspects of their work, right? Like what are the power needs? How do you actually educate and provide educational materials for the users of these types of systems? How can they help inform FEMA or other agencies that might be essentially in a better position to respond during a national disaster? They recognize that they can only touch very few lives, the members of GRID. So they're really trying to focus on answering those important research questions.
That's great. I'm gonna actually pass the questions to Facundo, who's been waiting as well. So Facundo, please unmute yourself.
Hi. Well, thanks for the presentation. I think it was amazing. I think these kind of projects are like very motivating for us that are studying energy. Also, I wanted to ask you, where from Argentina are you? Because I'm also from Argentina. And regarding the presentation, I was thinking, like, if the group study how people cook the food, like what type of energy they use, if they were using like the electric energy from the solar panels, or if they were using fuel. Also,
No.
how did they like clean the water, potabilize the water? Like, because you say there was like a short supply of water.
Mm-hmm. Yeah. So, okay, I'm from Buenos Aires, San Isidro. That's where I grew up. And so several questions here. so for cooking the food, the the solar systems are just not powerful enough to really run any kind of like resistance heater, right? So that was a no. We told them like you cannot connect your air conditioner, you cannot essentially use this for blow drying, like so that was part of the education we had to do. Fortunately, I mean, a lot of the households in Puerto Rico use natural gas as a cooking fuel. So that was actually it was something that wasn't too hard to actually find. So I didn't recall hearing many people running out of like ways of cooking the food itself. Finding food and storing food, like especially fresh food, was definitely a problem, right? Like you couldn't buy meats because they would essentially not last without refrigeration. Or if you bought meat, you would have to essentially buy it and use it on the same day that you actually bought it. The water problem was actually a very significant problem. And there are also other researchers that actually specifically focus on understanding how the lack of electricity affected also the lack of power. So in Puerto Rico, a lot of the water that is clean and distributed by the water agency, Acueductos y Alcantarillados, uh, they run on pumps that need to actually move the water to a lot of these rural communities. So when the power went out, those pumps also stopped working, and there was no access to clean water, potable water. So a lot of these communities responded by essentially just drinking and accessing water that wasn't coming from the potable sources. And a lot of people actually got sick because of this, and it's actually documented. Fortunately, the water agency could respond faster because they could just put some generators specifically to power those pumps, and water actually came back much faster than electricity did. So yeah, but it was a major issue. And even in the water treatment facilities, the water quality was not on par of what was expected during normal times. It took a long time for them to meet the same level of water quality that was required.
All right, we have a lot of questions that have come into the chat line, so I think we probably will get through one or two of them. If anybody who submitted a question in the chat would like to ask it verbally, please just raise your hand and I'll go for it. The next one though is asks whether you had challenges procuring power measurement sensors or collecting data.
Yes. So this was again, we had to organize this project really quickly and coordinate. So we didn't develop things ourselves. We actually just pulled components from that we could purchase and would allow us to log this information. So the components weren't internet connected, as you can imagine. They were literally just logging information that we then had to physically go and visit the families and essentially almost like grab the black box and take it with us, and then analyze the data after the third trip. What we used was let me see if I can go back to the slides. We purchased a charge controller that actually had a capability of logging this charge controller, we purchased it specifically because it had a logging capability. So we actually had a small box that actually allowed us to measure how much solar input the batteries were getting, but it couldn't actually measure output. It just could measure input. So for the output, what we did was we purchased these devices that actually are used for making, I think, what is it called? On-site logger or something like this. They're essentially used for making power audits, right? Like if you want to find out like how much electricity your refrigerator is consuming, you can actually connect these between your outlet and your refrigerator, and it can actually tell you you're using this many watts, for example. But these loggers actually could store information in them, and we could then come back and actually grab them. And we asked the users as much as possible if they could also try to actually tell us like how they're using these devices, so we could then compare and try to analyze as best we could what was the consumption like for different devices, because you don't have the identity of the devices You just know how much power it's actually being drawn from the inverter, but you don't know what they're actually connecting. So that was correlated then with essentially information that was provided by the users themselves.
Great. So I think this will be the last question given the time, but we have one that's asking, what scale do you feel decentralization of energy production, nano versus microgrid scale, will lead to greater resiliency in geographically isolated areas? So would community scale investment in centralized emergency energy systems make sense?
Sorry, I got frozen. I think I didn't hear at all the
Oh,
question.
sorry, you can also open the chat line there.
I don't get to
Yeah.
see it. I think I have to stop sharing to do that.
Ah, okay. Well, I will try again here. So what,
Sorry.
no, what scale do you think decentralization of energy production will lead to greater resilience in geographically isolated areas, nano versus micro, for example? And would community scale investments in centralized emergency energy systems make sense?
Yes, totally. I think that I don't think that it makes sense to have essentially nano grids other than, I mean, for this particular really, really small scale. Microgrids are the way to go. And actually for communities that are isolated, it makes perfect sense. And there's already an example of communities doing this already in Puerto Rico. For a long time, they've been doing this for water. So for example, some of these communities are so isolated that the water authority actually doesn't deliver potable water to them. So they've already had to essentially coordinate as a community and invest in a potable water source that is going to serve them. So fortunately, after the hurricane affected the island so badly, the government essentially changed the law to also enable small-scale producers that essentially opened the door for microgrids to become legal. It used to be illegal. You couldn't actually get together with your neighbor and say, hey, let's actually make a microgrid between our neighborhood. That was actually not possible because you're using the electrical grid facilities to connect to each other. So now it's actually is possible, and there are communities that are going that route. So they're becoming essentially energy independent. And it totally makes sense to do this at the microgrid because a lot of houses just don't have the adequate sun exposure to actually have their own production facilities. So you have to share it, and there has to be a way of actually being able to pay somebody, right, for power where maybe their house or maybe they have a field where they can install a large number of arrays that can supply power to the community. So yeah, this is definitely the way to go for isolated communities in particular, but in general too. Like it's proven to increase energy resilience for nearly every community. So again, this is outside of my research area, but from what we saw, it definitely seemed like it would definitely help the communities that we visited.
Great. I think maybe one quick response to the last question that we can fit in. But the question is, are there lessons we can in the US learn from the way families adapt in the immediate aftermath of power outages as they become more frequent here in the continental US?
Yeah, I think the one thing we learned and were like really very, very happy to learn about was the amount of help neighbors gave to each other. So I haven't experienced a similar, obviously, type of situation here in the US, but I would be hopeful that a similar type of like help and societal coordination would take place. It was just incredible. Like neighbors essentially providing power for critical needs, right? Like if you, yeah, if you were faced with like necessities for your medication or even if you needed evacuation, the amount of help that neighbors gave to each other was just outstanding. It just inflated your heart essentially to see this happening. Now, we can make that essentially communities better prepared by again, like I mentioned, changing our policies so that we have more storage installed in addition to just essentially grid connected solar systems. So even if I wanted to help my neighbors, right, with power, but I have a solar system that goes down when the grid goes down, then I won't be able to help them. So having at least some critical number, right, of robust access to power is really, really important. And you can see it already in Puerto Rico too. Like they're actually installing solar systems in community centers, in schools, because they are realizing that during a similar emergency, those can become oases to help the communities that are surrounding them. So I think that we could definitely take a clue from that and actually prepare our communities also.
All right, well, let me just thank you again, and folks are welcome to use the applause reaction if you'd like on Zoom here to give thanks for this wonderful presentation. So as a reminder, anybody who signed up for lunch, well, virtual lunch with Professor Pozzo, there's a separate there's a separate Zoom link for that, and we'll reconvene at about noon to give you guys a little time for a break. So thank you very much again, and for some of you, we'll connect again in about 10 minutes.
Yeah.
All right.
Yeah, I want to say one last thing is if you guys are at all interested in emulating some sort of model similar to grid, contact them. And if you can't find them, contact me, and I'll give you their contact information, because I think that what they're doing is outstanding, and I hope that more student-led organizations actually pop up across different institutions. So I'm sure that they'll be happy to connect with you guys.